This is Dr. Maynard bringing you another video from Bariatrics, talking to you about eating of red meat after surgery. Typically with all patients, you are started on a liquid diet prior to surgery. Usually that liquid diet will last for about 2 weeks pre-surgery. You leave the hospital also on a liquid diet for another 2 weeks. Once you come and see us at that first 2 week visit, we start advancing your diet slowly over time. Red meat seems to be one of those things that patients tend to have difficulties with in varying degrees. And so we typically have you start off doing ground meat, sort of like ground turkey, ground chicken, tuna, and then over time start adding things like your ground beef, your hamburger meat, usually in things like chilies initially. We have most patients tolerate that relatively well. If it's not tolerated initially, we have you stay away from it for a couple of weeks and then retry red meat in the form of a sauce, chili sauce, spaghetti sauce. And if you're still having issues, then we will probably forego that for another couple of weeks. If you tolerate your chilies and your meat sauces well, then we'll add things like hamburgers and see if that's well tolerated. Lastly, we would add steak to the mix. For the patients that have no issues, we generally at your 6-week visit will tell you to, at that point you're eating a full diet with the exception of steaks and pork chops. At that point, we'll generally send you out to have a steak dinner, small steak, of course. So red meat is part of a good balanced diet, and it's a good protein source, along with the others, chicken, shrimp, tuna, fish. It is one of those that allows you to have a good protein source. And so adding red meat to your diet is so you have variety and a certain density of protein. However, red meat can sometimes not be well tolerated by patients post-op. Problems patients have when with intolerance of red meat. Some patients have just abdominal pain, so they take red meat, particularly with hamburgers and ground meat, and that's mostly an issue of eating that too early on in the process. The stomach is not able to manage that well. Over time, that gets better and goes away. Some patients, this can last for several months. The other thing that will happen if you eat chunks of red meat, sort of steak, you end up having nausea and vomiting, and that can be usually a problem as well. We take it and graduate you through that process we talked about earlier, where you start with ground meat, then over time you add red meat to it, usually in sauces, then you add hamburgers, and then end up eating steak if you're having problems at the beginning. But those are the main issues. 1, the abdominal pain. 2, the nausea and vomiting. And those are the two main issues that you can have trying to tolerate red meat early on after surgery. If you have questions, you want to set a consultation with us, please contact us with the information below.